act can give. One of the dangers, I think, is that it contributes to the idea that you're going to make somebody do something they don't want to do or make them look foolish. And so those are all ways that are not empowering. And they perpetuate that myth that power is, taken away from you or control is taken from you. And I always have to laugh when I think about some of the movies that I've seen where the whole movie is science fiction or I call it social fiction, social science fiction. But the thing people believe is the part about the guy pulling out his watch and putting the damsel in distress under, and
it's the part that people don't question.
Right. Yeah. So it's interesting. But I totally agree, and to me, I'd like you to share your perspective on this, because to me, some of that's the frustration of working with, offering hypnosis, which I think is a wonderful, empowering. I feel like every human being ought to know about it, because it's working with them or against them all the time, the phenomenon. But it's the, getting people to see how important it is for them to learn this stuff, and to, not necessarily come in to be changed, but to learn how to make changes.
Yeah. So, one of the first things, that I talk about with that is start to talk about how it is in our lives, all the time. And so part of it, when we talk about hypnosis, uses our ability to go into trance or trance states. When I talk about trance, I have a very simple definition, and that is just anytime you focus your awareness in such a way that it shifts your normal orientation to the world around you, then you're in a little bit of a trance. And the common example I use is people driving maybe to and from work, and you may arrive at work or back at home, and you kind of wake up and you realize, oh, I'm here already. And that's a very common experience that a lot of people have, and it's natural in that sense, and that's what a simple, maybe an everyday spontaneous trance is like, or when you're absorbed in a book or in a good movie or something like that. And so my sense of what hypnosis is then is it starts to make that trancing intentional, where you can choose to shift that consciousness a little bit. And in doing that, we become more receptive or more open to the ideas that we bring into our minds. And that's where the idea of suggestibility or intention or affirmation, which is really big these days with these movies like The Secret coming out, and how you can intentionally change your life. Well, I think you can, and there's some limitations to how that can happen, but that's where what we do, I think, is really valuable, in that when you shift your awareness a little bit out of your normal, maybe more critical conscious thinking mind, then you become more open and more receptive to those kinds of ideas. And then you can really choose, what is the intention that I want to bring to mind in this moment. And what's interesting is to notice how we're always going in and out of these little trances. You see, an accident on the street, and everybody kind of goes into an altered state. Everybody slows down and looks, and there's a real curiosity and openness, maybe a shock. And we don't realize it, but we're really suggestible in those moments.
Right.
And so you can think a calming thought to yourself, or you can say something calming, and it has much more effect than if you were just to say that in a normal, everyday state of mind.
Right. And it also, I think the other part of that is when you're conscious of that, you can counteract things, or we call it reframe things, that are said to you, or that, there are numerous stories I could tell about how someone said something, and if you would just let that be the definition of the situation, the outcome would be totally different than if you said to yourself, that's that person's perception. My perception is this, and I can, let's just say in general, I can do this, or it can be done, or
no, I'm okay. Right?
Or I'm okay, or the limitation that's been suggested is not necessarily the defining limitation, or the
exactly.
So to be able to be conscious of that, and to me, it's a sort of psychological self-defense that you can develop with knowledge. And,
for me, like the example that came to mind for me is, many people I know talk about when they go back home to visit parents, you become childlike. Suddenly you find you're acting out the old roles of when you were a little child, and that's a trance. We get into the family trance where suddenly, I've grown and I've matured and I'm now an adult, and yet when I go back into that situation, those childlike characteristics start to come out. So having some awareness of it and consciousness of it, and I think that's the key to begin to become more conscious of when we are shifting into those different states. And like you said, then as it's happening, then to remind yourself, and that's what comes with a little practice, to think a thought like, no, I'm okay, I'm a mature adult, I can respond consciously to this.
Right.
And some of it for me is a real connection to the body when working with the subconscious. And so if I can pay attention, what am I feeling right now? What's the sensation in my stomach? Am I hot or cold? How is my breathing? And a lot of that really helps to sense when I'm shifting, when I'm going into a different state.
Right. Well, and I think this would be a good time to talk about some of the things we were talking about earlier, and that is that you're working more with the Benefice organization in Great Falls and getting more involved with integrating and interacting with the medical community.
Yeah, and that's actually something that's really exciting, and I'm sure you've seen that too, Will, that from my experience, hypnosis has kind of gone in and out of vogue, and it's more accepted for a few years and then there's more skeptical, and it seems now that there's certainly a trend towards more complementary therapies and alternative ways of seeing the mind and the body. So I've been fortunate to be kind of working more. I've been volunteering with hospice in Helena for the past 4 years and working with terminal patients, helping with anxiety, with chronic pain. And also now I'm working up in Great Falls a little bit more and working in the hospital setting, teaching some self-hypnosis classes on sleeping better, on quitting smoking, on pain control, things like that. And it's really nice that these kind of treatments are really being brought much more into the mainstream medical community, and they're seeing how, like studies showing that a little self-hypnosis, a little safe place imagery, taking someone to a safe place and teaching someone that when they're going into surgery, it tends to reduce the amount of time in surgery, it tends to reduce the amount of medication that they need, and it increases or speeds up their recovery time, and they feel safer overall. So just a simple little technique that actually adds a little bit of time actually helps everything go smoother.
Yeah, and I think that it's important that once you have made that, established that place in the medical community, it's important that I feel, and one of the organizations I belong to, International Medical and Dental Hypnotherapy Association, it's primarily their goal is to have a hypnotherapist on the staff of every hospital in the country, and part of that, and what I want to throw out to you is getting the medical staff themselves savvy in terms of how their language and the neurolinguistics of what they say to a patient. It could be just one phrase as they start to treat them, or just things around pain, using terms that aren't going to suggest the treatment's painful, actually using terms that suggest that this is, safe, a great treatment, this is going to help you a lot, rather than this is going to hurt. And, there's that kind of, dynamic, and the natural dynamics of hypnosis are present when somebody defers their opinion to someone as viewed as powerful as a physician or someone who's there when they need to hear the right thing.